Warning, warning. As a medical doctor, I must inform you that there are side effects to this coaching session. Beware. It may enhance your self-esteem, cause you to experience vibrant health, encounter long-term weight loss, heal damaged relationships. Warning, there are side effects to this coaching session. It may increase your enthusiasm for life and bring about hope. It may cause you to have productive and optimistic thinking. It could even help you not allow messed up people to ruin the rest of your life and help you realize the masterpiece that you are and empower you to be the boss of your brain. Warning, these side effects may be long-term. This is Dr. Isabel from Doctoronamission.com. Welcome, Lori Marini. I am so glad you are here with us here at Doctor on a Mission. How are you doing?
I am well. Thank you so much for having me on. I'm truly honored.
My pleasure. Let me introduce you. Lori Marini is a motivational coach and a cancer survivor who specializes in empowering women during and after their healing journey. I love that. Many lose their purpose after a crisis, leaving them paralyzed. Coach Lori guides them to their higher purpose on many levels. Lori supports clients in identifying what is holding them back and together take the first courageous step in living an amazing life. Lori is the founder of Lori Marini Coaching. She is a certified pathologist assistant, life, wellness, and cancer coach, Reiki Level II practitioner, author, and speaker. Hi.
Hi.
Where are you coming from?
Oh my goodness. So right now I am coming to you from Sarasota, Florida. I was originally based in Nashville, but the universe had different plans when we lost our home in a tornado. So when that happened, we're like, it looks like it's time for palm trees. So we made our way at the beginning of the pandemic. We got a moving truck and we moved our way down, and it's been amazing ever since.
Are you close to the water?
Yeah, 5-minute walk.
Yeah, it's amazing. Oh, good. Are you a beach person?
I love the beach. So being landlocked in Tennessee, even though I loved the state so much, the ocean is a missing for me. So I'm very blessed. I do a daily walk every morning where I go and I visit the water, and it's really been, when they say you need to create a life that you love and create it in a way that it provides you peace and happiness. Like, I feel I finally did that.
Good. Well, you'll have to come visit us down here in New Zealand, and we'll go to the ocean too.
Oh, you're on the top of my list. Honestly, I'm not even joking. I have been talking about that for years. Absolutely. You can count on it.
Cool. As soon as this pandemic thing ends.
Absolutely. It's been a little wild.
Well, I'd love for you to share your story, okay. Before, during, and now. Okay? Because people learn from other people's stories, and so it's all yours.
So I have a very unique story in the fact that before I was diagnosed, I worked as a pathologist assistant. And so I have a master's in it. And what it is, it's really someone who has studied tumors and is a tumor expert. I'm the person, when you get something taken out of your body, at the time of surgery or your biopsies, they come to me, I examine them. Most of the time, a pathologist will never review your actual tissue. It's somebody like me who will do that work, and they get the slides. So my entire life, my entire career has been based on tumor diagnosis. And I have been very blessed to work with some amazing people. I was setting up a center for precision medicine, a genomics center, and I went in for my baseline. So before I even get to that, I was in the best shape of my life. I was eating well. I have no family history. I did a self-exam. I didn't feel anything. And when I was 40, my primary care physician said, Lori, you need to go get a mammogram. I was so busy at work that I never went for that mammogram when I was 40. So when I showed up to the office at 41, the first thing that came out of my mouth was, I'm so sorry. I promise I'm going to go. And she says to me, she's like, Lori, you actually just bought yourself 4 more years. They just changed the guidelines to 45. She gave me an exam. She sent me on my way. And I literally sat with it. I'm like, I don't feel right about this, but all right, let me think about it. And I had a dream. I was riddled with cancer. And I called up my bestie and I said to him, I'm like, I am freaked out. I feel like this is really a message. Can you please stay on me to schedule this mammogram? And I don't know why that was the test that came to mind, you know, like it could have been anything, but for some reason it's what my intuition was telling me. So I called the office that I was going to go and try to get an appointment for, and they happened to have an appointment the very next day, which those of us in medicine know that never happens. So I went the next day, they gave me a baseline, and they immediately called me and said, we need you to come back. So I went the following day, and I had a 3D mammogram with contrast, and then they moved on to ultrasound. And by image 65, and they're in my lymph nodes, I knew something was up, right? Like I spent the past 20 years looking at these images. Like I knew what I was looking at, and I was like, uh-oh, there's something going on. And, you know, it's really funny how your brain works, because I'm like, okay, there's something there. And I literally started writing my will. I literally started saying to myself what I'm going to do when I'm over this whole thing. Like I planned the rest of my life out before they even told me the words, you have cancer. And I walked out of the office and they told me, you're going to need to come back and get a biopsy. So I went back, I got a biopsy on my left side because that's where they saw an abnormality. And it just so happens that that abnormality was 4 masses on my left, with the largest measuring 2.2 centimeters. So those of us who work in the field, or if you've educated yourself on how tumors work, the key number for breast cancer that you do not want is anything over 2 centimeters. And because that upstages you, but also the thing that really just blew my mind was that, like, I can't feel them. I just had a professional feel them too, and we didn't feel anything. How do I have 4? Like, really?
And if I just may ask one more time
Yeah.
for clarification for our audience, how big were yours?
So they range from 0.5 centimeters to 2.2 centimeters.
So just that 0.2, really?
Yeah. So 2.2 is like a golf ball, right? And we couldn't feel it. And I was a B cup, I was in my 40s. I started my 40s, so they weren't as perky as they used to be. You know what I mean? Like, if
I know what you mean.
if there was something there, we should be able to feel it. And we didn't. And it really, like, that's what really stood out for me. So I went and got a biopsy. I was an awful patient. It's just, I'm even embarrassed to say it. Like, I told the attending I only wanted attending to work on me. I don't want extra passes. You need to make this quick and let's go, right? Because I'm used to being on the other side of the table. And I'm like, and she looked at me and she's like, well, you're in a teaching hospital. And so I'm like, I know that, but I also know I have the right to not have a resident learn on me. I'm like, I've taught residents for 20 years. Like, can we just hurry up? And like, I felt bad afterwards, but like, that's just kind of where I was. This poor woman. I feel terrible, terrible. So she went ahead and took multiple passes. I think I had 12 passes taken on my left. And I asked for her to show them.
What is a pass for the audience? What is a pass?
Oh, so a pass is every time the biopsy gun fires. So they'll make a little incision in your skin. They'll put this, it's a metal tube that has a knife at the end of it. It sounds really medieval. You don't feel it, really, kind of. But it'll actually make a noise and it'll click. And every time it clicks, it'll take a sample of tissue. And that's what I've worked on my entire life. So I looked at her and I'm like, I need to see these. And she's looking at me like, what? And so I looked at them and I'm like, I knew the second I saw them, I'm like, there's cancer. And nobody had yet to tell me that I had cancer, right? They still had yet to say the words to me. And I just knew by how they looked, you know, that's what I was doing for the hospital, is like, I'm the person that selects the best sample, because sometimes you can't submit an entire, you know, sample that you get. So you have to know what you're looking at. And I knew. So I walked out of the office, just, I didn't know what to do with myself. I'm going to be really honest. And the first person I called was my boss, who just happened to be a world-renowned breast oncologist, you know. And I want to back up for a second, because the universe puts you exactly where you need to be. If something keeps showing back up in your life, like over and over and over again, take the hint. For me, what that was that I had this prestigious hospital, you know, medical center in Boston that kept asking me to go and work there. I turned the job down 3 times. And I'm like, they can get anybody. Why do they keep asking me? I started in May of 2015. And by June of 2017, I was diagnosed. And I was working for a breast oncologist. And the second I told him, I'm like, look, this is something. He said to me, Lori, it might be nothing. I'm like, I saw the tissue. It's what I do. Like, I know. And he just ran with it. He scheduled all my appointments, made all the connections, like did everything for me. And I will be forever in his debt. Like, I'm just so, so grateful. But, you know, I often think about 2 things. One, if I didn't make my way to work with this guy who got me into surgery in 2 weeks, like, how would my have treatment gone? And 2, if I didn't have that dream that got me into action, oh, you know, where would I be? And 3, if I listened to my primary care provider, not my intuition of, I really need to go and get tested, I probably wouldn't be sitting here today. So for me, it's one of those things that I no longer question anything. I just go with it. And, you know, in hindsight, looking back, that's the best thing I could have done, was really listen to myself. So I elected to go, well, I always said to myself that if I was ever in this position, that I would automatically get a bilateral mastectomy, because of my background and having seen what patients have gone through from surgery, you know, when the margins are too close and all the revisions and all of that. I was just like, you know what, I'm not playing that game. But it just so happened that I had DCIS. So I had to go in for a biopsy on my right. They proved to have DCIS on my right side too. And for your audience.
Stop first.
Yeah.
How did you know I was going to ask you for clarification?
So I had infiltrating ductal, proven carcinoma on my left side, and DCIS is ductal carcinoma in situ. And so what that is, it's a precancerous state. It's, you have some changes in your cells, but they haven't turned into invasive cells. So if you have DCIS, you're closely monitored, because at some point, some patients may actually cross over into the invasive component. So for me, knowing I already had invasion on one side, it was a no-brainer. And I was telling my oncologist, my surgeons, I'm like, no, we're getting a bilateral. And they're like, Lori, you're being too aggressive. I'm like, no, this is what I'm going to do. And when my biopsy came back with DCIS on my right, nobody argued with me anymore. So I went in for treatment. I had lymph nodes done. We went through all of that. I ended up electing to get reconstructive surgery through expanders and then implants. And that's a whole conversation that we could talk about. But honestly, you know, it was a very trying time for me. And it was very difficult because I knew a lot. You know, I knew more than what they were just telling me. I've also seen firsthand the devastation that this disease causes for so many people, that I was really overwhelmed.
So then what happened after the reconstructive surgery?
And then I needed a revision. And then I got put on tamoxifen. And tamoxifen, if anybody is on tamoxifen, it is one heck of a drug. And I tried to get off of it, and I did hormone, like a Dutch test to see where I'm at. And it was at a point where when I started working with a naturopath, and she said to me, you're going to need to do one thing or another. You either need to get back on the tamoxifen, or you might need to consider getting your ovaries removed. But she really believed that because of the level that the estrogen that I have running through my body, I was just a time bomb waiting to reoccur. And so when they say that to you, you're kind of like, what do I do? So for now, I chose to stay on the tamoxifen. It's not my preferred. And I'm still in the inquiry stages of what other options do I have. Like, I'm really clear that diet can really help. I've implemented a lot of things in my diet. But at the same time, I'm at that struggle that everybody is at, where I'm like, what's the choice? Right. What do I do?
And so you're obviously doing research
mm-hmm.
and learning to become the CEO of your health, which I congratulate mm-hmm. you for taking control of that.
Thank you.
That's something we really encourage and teach here at Doctor on a Mission. So what's your vision? What's your why now for your future and for the business that you've created?
So my coaching business came from the fact that while I was going through all of my follow-ups at the facility where I had worked, mm-hmm. I was completely overwhelmed. I didn't know if I was coming or going. And it's like, I've worked in this field for 20 years. I know I know the language that they're telling me. I know where to park. I know where the bathroom is. I know where the cafeteria is. Like, why am I feeling this way? And it was one of those things that I'm like, if I feel this way, how does anybody else get through it? And so that put me into action. That put me into, how can I support others? And that's how Lori Marini Coaching was born. I literally, with both feet first, I became a certified coach. I informed myself of everything that I could possibly need in order to benefit patients. And my focus has been with supporting women. Once you are beyond your treatments, you're left on your own, and you're left with, I like to say that you're just hit with a ton of bricks, usually like 2 years later, after everything settles, with the emotional side of what you're going through. And it's like, what now? Do I make plans for the future, or do I just sit here and wait to get a reoccurrence? Is there any point in like trying to look pretty or making myself be healthier? Like, am I just a walking time bomb? And that's what I support people with. It's like, you know what? We can't control what's going to happen to us, but we could set ourselves up for success. We could set ourselves up in a way that we can live life every day. And if today is our last day, we'd be proud that this was the day that we had.
Mm-hmm. And just be your best self for that day.
Exactly. And and it's so hard to keep that positive mindset of like, today's a day, today's it, and be okay that, tomorrow may not be so great, but you'll handle it. And that's the other thing that we work on is like, okay, you got some bad news. Your skin didn't come back the way that you wanted it to be. But you know what? You've gone through everything this far. You're tough. You're a warrior. And that's why we don't use the word survivor in my group. We use the word warrior, because we're not going down without a fight, and we're not at the effect of our disease. We are in control of what our bodies are doing, and we are going to do the best that we can, and to empower ourselves is really yes. where we stand.
And do you just simply work with women who have breast cancer?
No, I work with all tumor types, or even chronic illnesses, because cancer technically is a chronic illness. Mm-hmm. It's something that once you're diagnosed, it stays with you. So it's no different than any GI chronic illness. I don't exclude men, but women just seem to gravitate. So I've focused on them, but I've never turned any male, down. And that sounds really bad, but I don't mean it that way.
And what positive tools, what tools do you have to help people maintain a positive mindset so that they're the boss of their brain?
Oh, it's so important. A positive mindset can get you through anything, right? It's like the example I like to give to my clients is, you know what? Think about when you are looking forward to vacation. All you are is like, I can't wait to go. Like you're packing your bags like 3 months early and, you know, you're just so excited. And then you're on vacation and it's the last day of your vacation. And you're like, this is terrible. Well, that's the difference between a positive and a negative mindset. Like when you're still on vacation for your last day, you're still on vacation. Why aren't you enjoying that last day? Yeah. Instead, as humans, we focus on, I got to go home tomorrow. I got to go back to work. I got to go back to responsibility. So the tools that we use is, you know, first and foremost, meditation. Meditation is the foundation of just healthy living. It supports your soul, it soothes your soul, it calms your brain, it allows you to think clearly. So I tell my clients, start with 5 minutes, and you're not going to get it right, and just be okay with it, but just get in the practice of it, and then slowly increase your time every week. Mm-hmm. The second is journaling. And, you know, anything that's going on in your brain will manifest itself. I'm a believer that things manifest, that, you know, if you are focused on a negative point of your day, then you're going to miss the great parts that happen, right? And we do that, and it's normal and it's human. But what I found is that through journaling, literally just taking a notebook, I find that writing is better than typing, but you do you, right? Whatever works. And just sit there for 5 minutes, 10 minutes, uninterrupted, and literally just brain dump. It doesn't even need to make sense. Just put it down on paper. And with this practice over time, you will be able to just have clearer thoughts, a more clear mind. You will also start to see what your vision is for your own life, right? And that's one of the things that's so important that you get from both of those practices is if you haven't figured it out, or it may be something new, of to why you do what you do. Right? Why do you go to work every day? Why do you have the relationships that you have? Why do you go to the gym? Like, what's your why? And standing there and standing in, you know, being true to yourself and knowing who you are truly allows you to be and do whatever you want. And you live the most fulfilled life because you're being true to yourself.
So true. And I've got a sign that just reminded me, because I just refreshed this sign that I've got. I'm so into signs. Or you should see my house. I got signs all over. And one of the signs that I just refreshed was hold the image, because we as human beings always go to the picture in our mind. We walk towards that picture. Yeah. If the picture is don't hit that wall, or you're whitewater rafting, don't hit that rock, don't hit that rock, don't hit that rock. Well, guess what? Your mind is focused on that rock, and that's what you're going to hit. But if your mind is like, I'm going to make it down this down this river, and I'm not going to hit that rock, you're going to make it down the river. Yeah. So always hold the image of who you want to become.
I love that.
Key.
I love that.
So key.
And the other thing too, is like, it's okay to be angry that you've gone through what you've gone through. Like, it's okay to have those emotions, but use those emotions to propel yourself forward, right? Like you're not your cancer. Your cancer just happened to happen to you. And the other thing too is that don't compare yourself to someone else that's sitting next to you in the infusion room. Their journey is totally different. And statistics are just statistics. Just because you're a stage 3 doesn't mean that you can't overcome, right? We see that all the time where people have had a miracle and they've, you know, had something and then it disappeared, right? Like, and I truly believe that you can manifest what you want for your life. You can, standing in a positive mindset for yourself. And, you know, it's okay to be selfish in this realm of your life. It's okay to be selfish when it comes to you and your health. Like, you taking time for you is actually not selfish, but we find ourselves so many times putting everybody else's needs first before our own. And, you know, I even found myself doing that while I was, you know, with my bandages and I had limited range of motion. I was worrying about everybody else. And I said to myself, like, what am I doing? Like, now's the time. It's okay for me to just think about me for 2 seconds
And
have it be okay. Yeah. But we're so programmed, especially as women, to keep nurturing others.
Yes.
You know? And I thought
I
it was crazy.
know, girlfriend. I know.
It's like, what are we thinking? Like, it was insanity. So, yeah.
I wanted to ask you about fear. Like, how did you deal with the fear? What did you do, Lori?
You know, fear is going to be there. Fear always shows up. It will always be, there'll always be that voice in the back of your head that is saying, you know, with every ache and pain that you feel, like, oh, it's back. Oh, this isn't good. Oh, this is something. And honestly, you know, you have to use your mindset to overcome that. It's a muscle. If you constantly are like, you know what, if something happens, then I'll handle it. If something happens, I'll handle it. And move through life courageously. Like, have it be okay. You know, I often, it's kind of like the downhill skier, right? It's an example that will apply, I promise. You know, it's like when you're flying down the mountain going, you know, you're straight bombing down the mountain and you're going really, really fast, and the thrill of the ride is just the most amazing thing you've ever experienced. And then you might fall, right? There's that chance that you might fall, or you might have an amazing, you know, flight down that mountain. But that's the chance we take for everything. And some people never even choose to get in the game. They never even choose to put their skis on. So it's like, who do you want to be for yourself? Do you want to go ahead and, you know, be the best version of you for you and like keep moving forward regardless of circumstances? Or are you going to let your circumstances win?
I love that, because I grew up in Colorado and I love powder, and I so relate to that idea.
Right? Like, it's like, you know, you can stay on the blues all day, but like the black or like the greens, but those black diamonds are pretty amazing. And you feel accomplished after you do them.
Well, I never did. Well, I accidentally did a black diamond.
And you got down it, right? You survived it.
Well, yeah.
It may not have been pretty, but you survived it. I mean, I'm speaking for myself, not you. I don't know.
But I did like the powder blues.
Yeah. Right. And then it's amazing. So imagine going through a life where you never experienced that because you let fear stop yourself. You have so much more life to live. So that's why, like, I call myself a life warrior. Like, I'm a life warrior coach. Like, I'm going to be the person who's going to be your cheerleader to have you live. And honestly, you know, I've done it for myself. I've done it for countless other people. And it's like, we have to do it, because otherwise, why did you go through all that pain and all the treatments and all the suffering if at the end of it, you're not going to live fully? You might as well not have gone through that at all.
Then you're not living. Yeah, I love that. Thank you so much. I'm going to use that.
Yeah, of course. I mean, I live that, and I truly believe it. And, you know, the other thing too, that's a good tool is to surround yourself with people who won't allow you to stay in that negative zone forever, right? They need to push you. They need to get you out of there. And sometimes people don't have those people in their life. And that's why community is so important. If, you know, find a Facebook group. Like, I have a Facebook group. It's called Courageous Cancer Warriors. And that's what we do. We create a safe space where, you know what, if I'm having a bad day, or if I'm like freaking out thinking, you know, X, Y, and Z is going to happen, then I get in that group with people who have gone through something similar, and that they're going to just support me in it without telling me like I'm wrong or not understanding where I'm coming from. Because up until the point that you have someone say to you, you have X, Y, Z of a diagnosis that's going to forever change your life, you don't understand what that feels like.
You really don't. You
It's
have
terrible.
no idea. Yeah.
And we don't want people to know, like that's what I always say. I'm like, be happy that you don't know what it's been like, but thank you so much for being a support. Like, we don't want you part of this club, but if you just so happen to be there, like, we welcome you with open arms.
Yeah.
Yeah.
Yeah. And I see that you are coming out with a book.
Yes, I'm so excited. So this is definitely a huge dream of mine. I have partnered with, it's going to be 15 other ladies. And what we have is we've done a compilation where it's women who boss up in healthcare. And so we all have our own version of what it means to overcome adversity and our fears. And it's going to be pretty amazing. It's going to be out at the end of the year.
I will definitely be. I hope you have a volume 2 coming up too.
I'll see what I can do. I have a couple of things up my sleeve. But right now I'm really just focusing on the programs that I could give, for people to benefit themselves too. So
well, hold the image.
Yes, it's there. It's totally there. I joke around about it, but my love, my passion is speaking engagements. So I joke around and saying, watch out, Rachel Hollis, because I'm coming for you, right? But it's just, I find it such an honor for me to be able to share my story and to, if I've helped one person by having this conversation with you today, then I've really fulfilled my mission, my destiny. It's really, I really feel like it's my calling to be a support to people.
Absolutely. And I the 2 best days in a person's life is the day you were born and the day you realize what your calling is.
Yeah.
What your purpose is. So good. Yeah. I'm so glad you've had those
Thank
2 days.
You.
And
Thank
unfortunately, it comes from a mess, you
yeah.
know? So your mess is now your message, but you're doing it afraid. And I love that.
Oh, I love that. I love that. Thank you.
And how else can people reach you? Like, you've got things going on. Where can people find you? We'll be putting the link in, but sometimes if they hear.
Yeah, that's great. Thank you so much for that. So I have a website. It's lorimarini.com, super simple. And on the website, it shows my phone number, because yes, you can actually call me. You could text me. It has my email, because I would love to also hear from you by email. And it has my podcast. I actually have a podcast called Conversations with Courageous Cancer Warriors, where people who have been diagnosed with cancer, caregivers or healthcare providers, come on the show. They share their story, their expertise. And it's really just, it's a love project. Like, I absolutely adore it. I love hearing and supporting other people and sharing their story. And I have Facebook, Lori Marini Coaching. I have Instagram, Lori Marini LGS. And my Instagram page for me is Daily Gratitude. And it's something that I started when I was going through my treatment. It was a way for me to just stay positive. It's how my positive mindset began. And what I did is every day through my day, I would take pictures of something that I found beautiful, inspiring, or something that moved me. And at the end of my day, I would go through my pictures and I would choose the one that spoke to me the most. And then I would write what my experience was around this picture. And I found it really soothing. So on my website, you'll see there's a blog that's of these posts, but the really body of work is on Instagram.
Beautiful. I love it. Hey, thank you so much for your time and sharing your heart and your journey, which is just beginning now.
And I'm just so honored. Thank you for allowing me to share my story, and thank you for having me on. Like, I'm so grateful.
It's the Mutual Admiration Club. All right. Well, God bless you, honey. Have a super fantastic day.
Thank you so much. You too.
All right. Bye-bye.